the tougher things too. So we have to work collectively to make sure that those experiences and the things that children learn in that most vital part of the development stay with them are positive things. So here's what we know about early childhood development. Here's what we know about the work that you're so committed to. It works. It's indisputable. No matter where you go in North America, no matter where you go in the world, investments into early childhood development, without question, are effective. There's no doubt about it. You can look at data, you can look at all of the research, you can look at all the evaluations. It's indisputable. So, if we know that, why do we still struggle? Why do we still have our challenges? Why do we still have some of these gaps? Well, there's a couple different things about why I'm spending so much time going out publicly and sharing, discussing, listening to what people have to say in all different parts of the province. Spent a lot of time doing public consultations on early childhood development. Because here's one of the single greatest challenges that we face. The families who need the support the most vulnerable families, are also the hardest to engage. You know, I'll give you an example in my neighborhood. There was a mom that we met who came and visited us because she needed some support on social assistance. And she was pregnant. And so we wanted to let her know about the Healthy Baby program and how she could apply for the prenatal benefit and all of those things. She lived on Magnus Avenue. Someone passed away from her family, and she was originally from Norrie House. So she went back to Norrie House for the funeral. But she was up in Norrie House for a long period of time, for a couple months. But then when she moved back, she didn't move back on Magnus Avenue, she moved on to Burroughs Avenue. But we didn't know that. And so we were trying to track her down to make sure that she got into the Healthy Baby program that she needed. She never did get into the Healthy Baby program. So it's not that the Healthy Baby program is not effective. It's not that the prenatal benefit doesn't work. It's trying to make sure that we can find the people who need it the most. So services and resources only work when people are engaged. That's when services work. So we have to find ways and continue to ask ourselves, how do we engage the most vulnerable families to be part of the services and resources we have? And if there's gaps, to maximize the ones that are there. And are there new innovative things that we can do to be able to do that? Here's the second thing about early childhood development. Because it's so evidence-based, because the research, without question, is there, people know it works. We have to make sure that we create structures for more people to participate. So my job isn't simply to come and talk to all of you and say early childhood development is important, because you're going to say, well, yeah, we actually know that, Kevin. Is to go out and talk to people who might not be as aware of it. To bring in more people to the fold, to say you can play a role. One of the very first consultations I had done to launch this dialogue, this public dialogue, was at the United Way. We brought in all the experts, and we brought in a whole bunch of people from business. And I sat there and gave some thoughts, and then people, like we're going to do today, I walked around and I talked to people, and experts could share, we could have a good discussion. And a gentleman by the name of Greg Hansen, who is very successful, prominent business person. His actual daughter is an Olympic medal winner. Very committed to this. And he came to me and said, I'm in. Who do I write the check to? You see, we don't have the structure for that yet. We have to build the structure, so if we're going to build in philanthropy, we're going to build in private sector support, we're going to build in these people who want to contribute, we want to make sure that when we get that support, that it's going to connect in a way that's going to help you in areas that you're working in right now. Those are the reasons in which we need to have a public dialogue, to build awareness, to talk about some of the good things that are happening, and to continue to find ways to engage more and more people, because that's when the services of early childhood development are going to work most effectively. You know, really interesting, we had one of the other events that we put on was at the Aboriginal Centre of Winnipeg, right on the corner of Higgins and Main. And over 300 people showed up for that. And a lot of the media had come for that. There was a lot of attention on people coming there. And so I shared my thoughts like I'm going to do today. And then there was an elder had come, a senior. She had come, and the Free Press went to interview her after it was all done. And they asked her, why are you here? Her name's Elaine. They asked Elaine, why did you come? And she said, I'm here for a couple reasons. The first thing I want to say is, when I was a mom, when I had my children, I don't think I was a very good mom. I had a lot of addictions issues. I raised my children when I was on social assistance. I didn't think I did the best job I could. But I'm going to tell you something. I'm a fantastic grandmother. And you would not believe how much support I'm providing to my grandchildren. So I came here to tell the minister one thing. Whatever you're going to do to support children, please don't forget about grandparents. We matter too. What's interesting about Elaine's story is that she had that willingness to share her struggles. And it's very interesting when you get into things like early childhood development, how someone like that, and that engages more people. When I was asked by the media, did anything jump out to me as I've been doing these public consultations? Is there anything that has really, taken me back? Is there anything that has really surprised me? And I said, I'm always so surprised by people's willingness to share their challenges, to share their struggles, but to also share their hopes and dreams. The deepest sincerity of people saying, I just want to make things better. I'm always so very touched by that as I've traveled the province and listened to people. There was another lady that I've got to meet, and we just started the public consultations, and she phoned our office, and she said, I'm pregnant, and so I want to come, and I want my voice to be heard. And so here's the thing. I started a Facebook group because I know a lot of other future moms, but I also know a lot of other single moms. And so I started a Facebook group, and so there's a whole group of us coming. There's going to be 20 of us coming. So the question that we have is, one, is there any help to get us there to one of the consultations? We need, transportation. We need some bus passes or bus fare. And is there going to be childcare? So are you going to provide childcare? So even when I'm going out to talk about how we support vulnerable families, we have to start thinking about how we remove barriers so people's voice can be heard. So right at the very beginning, Wendy's voice was heard automatically. And so as we went out and talked to people, we wanted to make sure that we removed the barriers so people's voices could be heard. Now, one of the things in terms of engagement that I had learned is a lot of issues can drive people. A lot of a particular issue can get people interested and engage people. But there's another way to engage people. It's through a basic set of universal values that connect all of us. So I want to share some of those values that are vitally important and the things I have learned as I've traveled the province. One of the first